If you're pregnant, you want only the best for your developing baby. Now, should that include hiring a midwife? Well, here to tell us what they do and if you really need one is our resident pregnancy expert, Judith Schuler. Judy, thank you so much for coming back.
Thanks, Alex. Nice to be here.
We don't usually get to sit down together. So
no, usually.
I'm glad we do because I've heard of the word midwife before, and I'm sure many of our viewers have, but they may not have a real grasp on what they do.
Well, today I'm going to talk about certified midwives.
Okay.
And they are healthcare professionals who have extensive medical training beyond their regular training in the care of prenatal, postpartum, and delivery of babies. So they do a lot of things, and most of the time they're registered nurses, they're nurse practitioners, or they're physician's assistants. So they do have a medical background, and then they go beyond and get this extra. Now, you'll find some people who call themselves midwives, but they're not certified midwives. So you need to, I think, check out anybody's credentials who tell you that they're a midwife.
I mean, as with anything medical, I'd imagine you'd want somebody who's been to school for it for years and years and years. They're certified to the hilt.
They know what they're doing.
Right, they know what they're doing. And so if a woman does decide, well, first of all, how does she decide that she needs a midwife?
Well, usually a woman has a normal, uncomplicated pregnancy.
Okay.
If you've got issues that crop up at the very beginning, you don't want a midwife. You want to be seeing your physician. But some people choose a midwife because they have a lot more time often to spend with you, answering your questions, dealing with issues, helping you get through this pregnancy. So for some people who need maybe a little extra care, a midwife can be a very, very good decision.
Now, does having a midwife mean that you don't have to make as many visits to a doctor's office or a hospital? You still have to make the same?
You still have to make the same.
Okay.
The thing is, most certified midwives actually work like with a doctor in the office. Now, there are some places like in Arizona where they have a small, very small community where you might have a clinic. So the midwife would be there not under the direct supervision of a physician, but working with a physician. Other people work right in the doctor's office.
No kidding.
And so if a problem occurs or some complication arises, the doctor is there. And during labor and delivery, say your baby goes into stress and it really needs to be delivered quickly by cesarean delivery, then the doctor would be called in and he or she would perform that surgery. But most normal, uncomplicated pregnancies, like, a midwife can handle.
Would benefit from having a midwife.
Yes, maybe many people do.
Right. So what else, what else should people know about them? If they're considering, how early on in your pregnancy, for example, should you be considering a midwife?
Oh, you could even consider them before pregnancy.
Okay, really?
Oftentimes you go to the doctor's office and you see, you don't know you're seeing a midwife, but they perform tests, normal routine tests. They prescribe medication. They can counsel you about birth control. So they can help in many different ways. In the United States, we have 7,000 midwives, certified. Midwives, who attend at least 10% of the births, which is over 400,000 births every year.
Wow.
So they're quite a bit.
They're active.
They're very active.
Right.
And this is something that you'll be interested in. 2% of all midwives are men.
Really?
Yes, and they are not called mid-husbands.
Okay, that's a good. That sounds like the beginning of a joke. That's
they're
well
still
done.
Midwives.
Got
but
it.
if you're interested, you think that this might be something you'd like to consider, talk to your doctor about it, because that's where you would start. You'd start with a doctor and go from there, and then you know that the person who is taking care of you and your baby is more than qualified.
Right, and you're hitting hard the fact that you should look for the certification.
Yes.
Not just any person off Craigslist that says they're a midwife.
No, that says they're a midwife,
right.
No. You want the doctor to be the supervising and also able to step in and help in case of serious complications.
All right, well, that's just one of the many things we can learn from yours. How many books are you up to now?
We have 17.
17 books, everybody. Judith Schuler has so much knowledge and so much experience in this. Pick up one of her books. You're going to learn a whole lot about it, and I'm going to tell them where they can find it. But as always, Judith, thanks for joining us.
Thanks, Alex.
Absolutely. Now, to learn more about your pregnancy, be sure to check out Judith's series of books. Just visit her website, yourpregnancybook.com.